HIPAA became law in 1996, decades before anyone was pasting patient notes into a chatbot, but its rules still apply directly to how you use AI at work today. In this lesson, we're covering what counts as protected health information, how to use AI tools without violating HIPAA, what your organization needs from any AI vendor before you use their tool with patient data, and how privacy laws outside HIPAA, including state and international rules, are shaping healthcare AI. This isn't theoretical. Getting this wrong can mean a real breach, a real fine, and real harm to a patient's trust. By the end, you'll know exactly what's safe to type into an AI tool and what isn't. Protected health information, or PHI, is any individually identifiable health data created, received, or handled by a covered entity, like a hospital, clinic, or health plan, or by their business associates. That includes patient names, addresses, dates of birth, and social security numbers. It includes medical record numbers and account numbers. It includes diagnoses, treatment notes, and lab results. It includes photos and biometric data. And it includes any combination of details that, put together, could identify a specific patient. Here's the rule to memorize. PHI should never go into an AI tool unless that tool has a HIPAA-compliant agreement with your organization. Not sometimes, never unless that agreement exists. Any third-party vendor that handles PHI on your organization's behalf must sign a Business Associate Agreement, or BAA. It spells out how they'll protect the data, what they can and can't do with it, how they'll notify you of a breach, and how they'll dispose of it. Here's what that means in practice. Consumer versions of ChatGPT, Claude, Gemini, and similar tools do not have a BAA with your healthcare organization, so PHI does not belong in them. Enterprise versions, like ChatGPT Enterprise or Azure OpenAI, can be configured with a BAA, but your organization has to have that agreement signed first. And healthcare-specific tools like Nuance DAX, Abridge, and Epic's built-in AI typically already have BAAs as part of their institutional contracts. Sometimes you have a legitimate reason to use a tool that isn't HIPAA compliant, like exploring a differential diagnosis or drafting patient education material. In that case, de-identify the data first. HIPAA gives you two methods. Safe harbor means stripping out 18 specific identifiers: name, dates, geography below the state level, phone numbers, emails, social security numbers, medical record numbers, and more. Expert determination means a statistical expert certifies the re-identification risk is very low. In everyday practice, safe harbor is what you'll use. Instead of a real patient, you'd describe the case generically, something like this. A 58-year-old male with a history of type 2 diabetes and chronic kidney disease stage 3 presents with no name, no dates, no identifying detail, just the clinical picture. Even after a BAA is in place, ask 3 more questions about any AI tool. Is my input used to train future models? Many commercial tools do this by default unless you opt out. Where is the data stored and how long is it kept, since HIPAA requires that data be disposable when it's no longer needed? AI also opens new attack surfaces your risk assessment needs to cover. Prompt injection attacks try to trick an AI into revealing another user's data or bypassing its safety controls. Model inversion tries to extract training data back out of the model. Side-channel leakage is information that slips out through an AI's output without anyone intending it. All of these belong in your organization's security risk assessment. The FDA regulates AI used in clinical decision-making as a medical device, and the pathway depends on risk. Most AI imaging tools and clinical decision support systems are Class 1 or Class 2 devices, requiring 510(k) clearance or de novo classification. Higher-risk AI systems fall into Class 3 and need full pre-market approval. A newer framework called a predetermined change control plan lets manufacturers update their models within pre-approved limits without resubmitting for clearance every time. Knowing which category a tool falls into tells you how much regulatory scrutiny it has already been through before it reached your workflow. HIPAA isn't the only law in play. Several states have their own rules. California's CCPA and CPRA give residents rights over personal data, including health data held by companies HIPAA doesn't cover. Washington's My Health. My Data Act broadly covers consumer health data, including apps and wearables. Colorado, Connecticut, and Virginia have similar comprehensive privacy laws with health provisions. If your organization works internationally, add more layers. The EU AI Act classifies healthcare AI as high risk and demands transparency and human oversight. GDPR imposes strict rules on health data, including a right to explanation for automated decisions, and Canada's PIPEDA governs health data in commercial contexts. Multiple laws can apply to the exact same piece of patient data. Before you use any AI tool with patient-related information, run through this checklist. Check with your compliance department. Is the tool approved? Is a BAA in place? Verify the vendor's data handling policy. De-identify the information if the tool isn't covered. Document which tools you use and why. Report any suspected breach immediately through your incident response process. And stay current, because these rules keep changing. Remember the core idea from this lesson. PHI never goes into a tool without a BAA, consumer chatbots aren't compliant on their own, and de-identifying data the safe harbor way is your safety net. Go to this lesson on FreeAcademy.ai and try the de-identified example yourself in the interactive prompt playground, or paste it into ChatGPT or Claude to see how a compliant, de-identified query actually looks in practice.